diagnosed with sickle cell anemia. In 2005, she graduated from University of Lagos with a BSc Industrial Relations and Personnel Management. She's worked in the banking industry, brand management, event management, corporate communications. She's done it all right? She later started her own kiddies essential store called Bambini World and children tourism brand called Niger Kids Travel too. All right, so Yesla is blessed with a teenage daughter. She's an avid traveler who loves adventure and now dedicates her time to her family, businesses, and volunteering with sickle cell advocacy groups. Nice to have you here, Yesola. Okay, great.
Thank you, guys. Good evening, everybody. Thank you.
Good evening. All right, so our next speaker is Hadley Ikwe. Now, Hadley is a medical doctor with an MPH. He's a senior public health specialist with the United States Center for Disease Control and Prevention, and is a public health physician with more than 12 years extensive wealth of experience across and around vaccine preventable diseases such as HIV, AIDS, maternal, newborn, and child health and reproductive health, and rights for undeserved populations in Nigeria and Africa. In his previous experience, he has worked for several UN, United Nations agencies, including UNICEF and UNFPA, coordinating MNCH and nutrition and reproductive health and rights programs. Currently, is managing the United States government's routine immunization support to the government of Nigeria and leading the technical and financial support for COVID-19 vaccine rollout in Nigeria, and also providing technical assistance to other West African countries and Zambia. He's a father of 2 lovely boys and currently lives with his wife and children in Abuja, Nigeria. Welcome, Hadley.
Thank you so much. And it's nice to be here. It's an honor to meet everyone.
Fantastic. Good to have you here. So I'm just going to move on now to last but not the least. Sorry, 1 second, please. All right, so Destiny Chukwu is a seasoned professional with over 10 years of experience in health system strengthening, and international development. She oversees the management of CHAI vaccines, Nigeria's work across its management systems and capacity work stream. As an international development professional, she demonstrates a relentless passion for improving the health and socioeconomic well-being of the poor and vulnerable. Destiny provides strategic and technical support to the National Primary Healthcare Development Agency, NPHCDA, across multiple technical working groups. Now, she provided technical direction and input to the development of a 5-year national strategy to improve quality of routine immunization data, which enabled Nigeria to improve timeliness and completeness of its routine administrative data. Welcome, Destiny.
Hello, everyone. Good evening. Hi.
Good evening. Beautiful. So good to have you all here. As we go on, we'll get to know more about what you do as the questions are rolled out. All right, guys. So those are speakers for today. I'd like to let me just see how far we've gone with the. All right, so we have quite a number of answers that have come in. Yes, no, yes, no, yes, no, yes, no. Fantastic. All right, so I'm going to move on now to straight up to the questions. All right, so you all know what the theme is. It's sickle cell disease and COVID-19 vaccination. So let's get a background. I'm going to shine the light on Dr. Ugochi Ogo. We've heard what you do. We've heard what you do. So we'd like to know more about the COVID-19 vaccine. So first of all, let's start with briefly tell us what COVID-19 is. Yes, a lot of people have read, they've heard the news, but briefly, for benefit of those who do not understand, what is COVID-19?
Hi, everybody. Nice to be here. Thank you for inviting me. COVID-19 is a disease that is caused by coronavirus, by a kind of coronavirus. It's called COVID-19. The CO stands for corona. The VI is for virus. The D is disease. And 19 is 2019 when it was discovered. Now, this is to differentiate it from a disease that was found initially, many years ago, the SARS-CoV, which was the regular SARS virus, but this one is the SARS-CoV-2 virus. So that is the coronavirus that was found in 2019.
Fantastic. Thank you very much. Just straight to the next question. What is a vaccine? What exactly is a vaccine?
So vaccines are substances that we give people or we inject in people to help their body build immunity against diseases that could be deadly or very serious. So what a vaccine does is that it kind of probes your immune system to create what we call antibodies, which you can think of as the body's natural army, the defense system. And so when we poke the immune system to make these antibodies, they have that army ready so that when they eventually see that disease, then they have an army ready to fight the disease, as opposed to already getting that disease and then getting immunity. So vaccines help you provide immunity without having to go through the disease.
Great. So can a vaccine prevent me from getting COVID-19? I've gotten a lot of questions from people about this, so I'd just like you to.
So yes, definitely a vaccine can prevent one from getting COVID virus infection. Most of the vaccines that are out there are about 90 to 95% effective. Now, having a vaccine, it's not going to 100% protect you because no vaccine is 100% protective. So if it's 90 to 95% efficacious, it means it worked in about 90 to 95% of people. So there's always that little percentage that may not be protected by the vaccine. But in majority of people, it would be protective. So yes, a COVID vaccine can protect you from the COVID virus infection.
Okay, beautiful. I'm going to go on to ask you a question about data, which will then link me to talk to both Hadley and Destiny. So I know you're based in the United States, and when it comes to data, you guys are big on that. Do we have any data on the number of percentage of admitted individuals, especially sickle cell individuals that were admitted as a result of COVID-19 over there?
Yes, we actually have some data. There have been different groups. There is a registry called Secure Wscd registry that everybody can access online. And this registry keeps up to date with the number of COVID cases in sickle cell patients. Now, in addition to this registry, there have also been other reports of different cohorts of sickle cell patients with COVID. But this registry has the largest number, I believe. It has almost 800, about 784 when it was last updated in April. And they tell you like how many patients have had it and what was the outcome. There were about 784 patients, about 52% were female. And for hospitalization, 50.3% were hospitalized. So about half of the people were hospitalized who had COVID infection, the sickle cell patients. Great. Interestingly, we initially thought that people with sickle cell would do a lot worse than the normal population. But if you calculate the death rate, there were only 19 deaths out of the 784, which came to a death rate of about 2.4%. And looking at the most current data in the real world data for the regular population, the death rate is about 2.2%. So we haven't done too badly with sickle cell and the COVID.
Okay, beautiful. Thank you for that. So this will take me down to Hadley now. So Hadley, before I ask you a question, I'd like for you to just tell us what your role is. You work with the United States Center for Disease Control. So tell us what your role is as regards COVID-19 vaccine in Nigeria at the moment.
All right, thank you so much, Victor, and nice to be here again. So my name is Hadley. I work for the US government here in Nigeria at the moment. And so in my daytime job, I support the National Primary Healthcare Development Agency in coordinating planning for COVID-19 rollouts, as well as support the rollout process itself. Also trying within that process to develop priority groupings, planning, micro planning of how, who, and when people should get vaccines. Following that, in between rounds of the different phases of vaccines that are going out, also supporting the government in the critical thinking, assessing and evaluating all of the successes, challenges, lessons learned for each of the rounds so that we get better as we go. So that's part of what I do for the COVID-19 vaccine rollout in Nigeria.
Okay, thank you for that, Hadley. So when you talk about all of this, data just comes to mind. And part of the NGO strategy for improving vaccination amongst groups, disabled groups in parentheses, requires data collection. Do we have this data in Nigeria?
Oh, yes. So there's all kinds of data. And when you talk about COVID-19 vaccines specifically, the data is slightly different from people who have had COVID-19 or have survived from that. And so, yes, we have a robust system of data collection for COVID-19 vaccinations across all of the states in Nigeria, as well as the Federal Capital Territory, or FCT. Currently, the government launched a data system called the Electronic Management of Immunization Data. And so we have all of that data for people who receive vaccines. We know that currently we've vaccinated using the AstraZeneca vaccines, which is what is available for Nigeria at the moment for rollout of COVID-19 vaccines. And it's a 2-dose type of vaccine. And so we've vaccinated nearly 2 million people with their first doses. We're currently in the process of vaccinating the same set of people or cohort with their second doses for AstraZeneca. And so, yes, there's a robust data. We've had a national deployment and vaccination plan developed for the country where we've decided which priority groups get what. And so we have, even though we have paucity of real data as denominators in Nigeria in terms of our census, our population, the population of sickle cell people with sickle cell disease or warriors, as well as figures to show how many of them have been vaccinated at this time specifically. Yes, there is a data system that works perfectly, for all of that support for Nigeria in terms of to use for decision making.
Okay, that's really good to know. While you were talking about your role, you also talked about priority groupings. Where is the place for sickle cell disease warriors and other people with underlying conditions in the national vaccination strategy?
Yeah, thank you so much for that question. And I knew that was coming, closely after. So yes, for all of the countries and for Nigeria specifically, like we're talking about, we've had to settle down to first understand the fact that the demand currently for COVID-19 vaccines largely or hugely outweigh supply. And so from the beginning, while Nigeria, as other countries, were also struggling in the world market to get vaccines, to get available vaccines or quantities of vaccines, we had sat down to look at the different priority groups and try to map it out to say who, if we get a certain quantity of vaccines, should go first. So for Nigeria, we've had 4 groups. So the very first priority group are the healthcare workers, frontline workers, rapid response teams, people in the treatment centers, the clinicians, the nurses, the other healthcare category. In fact, support staff, the drivers, the body handlers, as well as strategic leaders, just to make sure that people understand that these vaccines are safe and efficacious. And these frontline workers, so to say, are the first priority group. The second priority group consists of people who are 50 years and above, because we have also seen using data that these are the people that are coming down, not that when they have COVID-19, they die more often. And so the mortality, and the burden of disease is more with people 50 years and above. So those comprise second priority group. The third priority group is where potentially sickle cell warriors fall into. And these are people with underlying diseases, people with cancer, people with hypertension, people with diabetes, people with all, airway diseases, as well as potentially, again, like I said, sickle cell. This wasn't called out, but we want people with underlying disease who are below 50, because recall priority group 2 has taken care of everybody 50 years and above. And so for people below 50, but above 18, which is the recommended cutoff age, 18 years and above, that could get these vaccines. So that's the third priority group, people with underlying diseases, underlying ailments. And then the final group are people in the general populace, starting with states that have the highest burden of disease, so that as we get vaccines available in country, we're starting from priority group 1 and getting towards 4 as we use campaigns and also routine methods to get to everyone.
Okay, fantastic. So I'm going to just go to quickly go to Destiny, and then I have a question for Jake as regards this. So Destiny, are you there?
Yes, I am.
Fantastic. So please just give us a rundown of what you do at the moment.
Okay. Well, similar to Hadley, because we do work very closely together, I do provide strategic and advisory support to the National Primary Healthcare Development Agency. So that spans not only just around the COVID-19 vaccine introduction, but also in terms of routine immunization as well. Yeah.
Okay, beautiful. All right. So are there strategies that are being put in place now to ensure the sustenance of routine health services, such as vaccination for people with underlying conditions? Because I hear now from what Hadley has said, they've been grouped third category, priority number 3. But are there strategies that are put in place to ensure that these things are implemented and sustained?
Yes, so in terms of, just to provide a bit of context, I think COVID-19, the COVID-19 outbreak was novel, not just obviously to Nigeria, but globally around the world. And because of that, there were a number of innovations that the country had to introduce.
Hello? Hello? I think we lost her there. Probably network. All right, so I think I'm just going to jump on to Jake. So Jake, it was going to be a follow-up of that question. You're in the legal world, if you might allow me to say. Are there steps that need to be taken to ensure this? Because the truth of the matter is, we could say, yes, we have these things in place, but at the end of the day, it's not implemented.
Can you hear me?
Oh, yes, we can hear you now. Hello?
Okay, sincere apologies. I wanted to delineate what those strategies were, but I had issues with my connection.
Okay,
so in terms of what has been done, we do understand that there are service-related issues and there are demand-related issues. So in terms of service, we do know that when the onset of COVID-19 happened, that there was a national lockdown that happened around the country. And one of the results of that is that it was even hard for healthcare workers to be able to get to their points of services. So in the primary healthcare facilities to be able to provide these services. So in response to that, one of the things that had to go out is an official communication to ensure that security personnel would allow healthcare workers to get to their the health facilities to provide those services. In terms of demand, we also do know that across board, with populations both that had sickle cell anemia as well as other communities of people, that the evidence showed that there was a high concern around the apprehension that if they access those services, that they would get COVID-19. So what we had to do in terms of community and demand generation is work very closely with existing traditional structures that communities like patients and people use to get information. So for instance, we know that in the north, they have the Mayangwas, which is Hausa for the ward heads. So we worked closely with them to sensitize them about the importance of still coming to health facilities to be able to access service, and as well as to be able to eliminate some of the rumors around COVID-19. So now in terms of availability of commodities and medications, particularly around vaccines, is one thing that had to be done is periodic routine review of the availability of vaccines that were available in the country at the time, so that we can ensure that there's appropriate allocation. So if one state, there may be too many, there may be an overstock of commodities, they would work very closely with other, the national, the NPHCDA to ensure that those commodities and supplies were redistributed to other states. So that was something that was also done. And also for healthcare workers, another thing that was a major concern is because, as Hadley mentioned, the first phase of priority populations were healthcare workers. but we did see that there was not an availability of protective equipment such as face masks and then so that they wouldn't get COVID-19. So one of the things that was also done is the NPHCD worked very closely with states so that they could be able to release the necessary funds available so that as healthcare workers are providing services, they're well kitted to prevent, to eliminate the spread of COVID-19 to other patients.
Okay, great. Thank you. However, were there any specific strategies as directed to people with underlying conditions, for example, sickle cell warriors?
So I think one of the major lessons learned, and I think for the future, since the COVID-19 vaccine introduction, is that we realized that there is a need to invest in having priority and targeted communication efforts for these targeted populations. So I think in hindsight, the immediate response would be no. But looking at even the first phase of the rollout to the COVID-19 vaccine introduction, we've realized that we do need to make more concerted efforts as a country to have those dedicated efforts to the target populations that we are trying to reach. So I think moving forward, even as Dr. Hadley had mentioned, there is a lot of investment in trying to canvas lessons learned around this first introduction. So by the time we're now reaching populations, including those that do have sickle cell anemia and other comorbidities, we're ensuring that we're giving them the dedicated interventions and strategies that are required.
Okay, thank you very much. Jake, you've had it all. So this was a learning curve from what Destiny has talked about. But what steps do you think will need to be put in place to ensure that these things that have been written down or these things that have been learned will be implemented going forward?
Okay, first, let me say thank you very much for having me, and I'm really happy to be a part of this conversation. I'm really grateful to see Scaf doing such great work, mobilizing knowledge in this very critical area. I think just hearing from Hadley and Destiny, it's important to recognize that even though there is some framework that includes people living with sickle cell, there was not a deliberate mention and deliberate targeting towards a very significant population whose health, even before the COVID pandemic started, was disproportionately being catered to. And so I understand that that's a very huge gap. And I think COVID-19 just exposes some of the disparities that already exist within our systems anyways. But just to say, what do we need to put in place? I think we may need to revisit some of the very critical conversations we've had even before COVID in terms of, sickle cell care and management in Nigeria. I think we need to move very briefly from a more NGO-ized approach towards providing healthcare to sickle cell warriors to a more health equity approach, because in so many ways than 10, I could think of the fact that because there's a huge focus on COVID-19, certain people who are living with sickle cell might not get the regular care that they need. Even in terms of the symptoms, which might be similar to crisis for some people, the ability to not get adequate testing on time. And so, well, we do know in terms from a legal perspective, the laws have been very, I wouldn't say backward, but redundant, has not been promising towards, providing the kind of care and support that people living with sickle cell need. There has been bills flying up and down, the sickle cell management bill, which hasn't really made any headway. But I think it's important to actually go back to the drawing board and use this as a learning opportunity to see that not only should we need a specific act, but the National Health Act, for example, the National Health Insurance Act, I don't see a reason why anybody living with sickle cell in Nigeria shouldn't have a special coverage to be able to get adequate services and immediate medical services, especially in such critical times and moments. What would be very simple would be, just like they've mentioned, I don't know why it wasn't mentioned that people who are living with sickle cell should get their vaccine upfront before any other persons, but just being deliberate about things like this is actually very important, because if they could mention diabetes or hypertension, knowing fully well that Nigeria houses almost the highest number of people living with sickle cell in the world, it's important to front and center people who are living with sickle cell. I mean, the UK, the US, and Canada has done it. Even in Ghana and Haiti, there was a deliberate, specific conversation. I know most of what was said was, well, COVID is new. We don't know how well it would do with the existing medical treatment that people who are living with sickle cell are going through. But so is most of, most of the issues generally. So I think prioritization is key. I think we might need to go back to the drawing board to ensure that there's some level of enforcement for care and support to be given with people who need them, especially at such critical times.
Great. Enforcement is key. Okay. Dr. Ogochi, I'm going to come to you shortly after I've spoken with Oyesola. I'm going to come to you as regards, these strategies we've talked about here in Nigeria. I want to see what have been put in place over there in the United States. Oyesola, how are you doing?
Fine, thank you.
Fantastic. So as I read earlier, Oyesola is it pronounced Oyeshola or Oyesola? Sorry, I don't know.
It's Oyeshola, but it's fine, yeah.
No, it's not fine, Oyeshola. Thank you very much.
Oyeshola.
Okay, great. So as I mentioned earlier, guys, Oyeshola is a sickle cell warrior. So over here at Scaf, we refer to individuals with sickle cell disease as sickle cell warriors. So she's a sickle cell warrior. She's an advocate. She's a mother. She's a businesswoman. She is strong. All right. So let's hear from you. All right. What was your experience like during the heat of the COVID-19 outbreak? Briefly.
Wow. First and foremost, thank you guys for having me here. I really appreciate it, and I do not take it for granted. What was my experience during the COVID-19 pandemic? Well, should I say that I was very happy? I would be lying if I said I wasn't. That I was in a system that worked, and I was in the UK when COVID broke out. Because I was so scared when COVID, I was thinking what's going to happen, However, so my experience is a bit different because I live in the UK. The minute COVID broke out, they said everybody stay at home. And immediately, you have to realize that the UK already has a database, which is what Jake was talking about, Even before COVID, we didn't really have a database for people with sickle cell in Nigeria. The other day, I was going to have an IG Live program, and I spent hours and hours looking for data on people with sickle cell in Nigeria, nothing like that, So immediately, COVID broke out. They said everybody stay indoors as much as you can, only go out when it's absolutely necessary. And within a few days, the government had come out with what they call them a list of people that would first, they said, okay, if you fall within these categories, you are termed clinically extremely vulnerable, of which sickle cell was under it immediately. So I was getting text messages, I was getting letters from Department of Health and what they call them. I was getting letters from the NHS. My county was calling me. At the point I was like, they're writing me love letters because every second there's a letter, there's something coming in. You need to stay at home. They would call me if you need support. It was amazing that shortly after they brought out a website and said, you know what, if you maybe live alone, you don't have anybody to support you, you can't go shopping, register. And they were bringing food boxes every week. The support was, they tried their best to make sure that we stayed at home before there was a vaccine. And when the vaccine eventually came out, there was a list, and chronically extremely vulnerable were number 4 on the list. As it is now, I've had both my vaccines. I had my second one in April. I've even forgotten about it. I'm just waiting for summer to, and get out there. So there was a list of healthcare workers over 70, then CEV people, which I fell under. The support it was really, really, it was a lot, Even when I had to go into hospital for my transfusion, you had seen that they had put in a lot of things in place. You would gel your hands. At a point, they started putting face masks by the door. You have to change your face mask coming from home. They did so many things to make sure that, even when we were in hospital, it was only extremely necessary. They changed most of our appointments to telephone appointments, only coming when it's absolutely necessary. And when we went in, I wasn't scared because I knew that they had done everything possible to make sure that we had the support, and they were trying to stop the virus. So yeah, it wasn't as bad as I thought it was going to be, But again, that's because the place I am, things actually do work, and they use all this data and everything in the right way it should be used. Yeah.
Fantastic. Thank you very much for that. You actually answered my next question already, because I was going to ask you if you had your vaccines, and yes, you had both. 2 doses already. Okay, good. So I'm going to move on to Dr. Ogochi. Somehow my question has been answered. So Dr. Ogochi, let's go back to the vaccine and sickle cell disease proper. Should a sickle cell warrior get the vaccine?
That's an interesting question. So should they get the vaccine would be a personal decision. But do I recommend the vaccine? Yes, I do. Why do I recommend the vaccine? I recommend the vaccine because sickle cell has been listed by the CDC, Centers for Disease Control, as one of those illnesses or diseases that you can have that puts you at higher risk for contracting the COVID virus. So yes, I recommend to my patients to get the sickle cell vaccine. I've had a lot of patients who have actually gotten their COVID vaccine.
Beautiful. All right, so let's delve a little bit towards pediatrics now. Someone asked a question here, Olufumi Koshebinu, says, can children with sickle cell disease take the vaccine? So let's answer that, Dr. Ogochi.
So children 12 and above can get the vaccine. So initially, the vaccine could only be given to people 16 years and above in most cases, but now the Pfizer vaccine, which you have 2 doses, has been extended to age 12 and above. And currently, there's still research ongoing to see if they can really eventually have everybody take the vaccine. But for now, 12 is the minimum age that you can get the vaccine.
Okay, let me run up to Hadley now. Hadley, are you still with us?
Yeah, I'm here, absolutely.
Okay, so driving this evening, I heard something over the radio as regards vaccinating younger individuals. What can you tell us about that?
All right, so just like Dr. Ogochi has just said, for a vaccine such as Pfizer in the US and in some other areas in the world, the recommendation has come down to 12 years and above, right? Mm-hmm. But for Nigeria, the current agreement and the decision by the leadership is to stick with 18 years and above. And so we are only looking at those who are 18 years and above, specifically adults, to get these vaccines. And like I said again, it's also an issue of equity and vaccine availability. Like I said earlier, we only got about 4 million doses of vaccines, of AstraZeneca vaccines for Nigeria, and expecting something close to that in the next few months. And so we still have a huge gap. And so the plan is to go, like one of the speakers has talked about, equity, to ensure that for those who are really in the front lines, they get this. And so currently the recommendation for Nigeria, or the accepted age, is 18 years and above. And so that's how we're faring. As we continue to get more information and get all of that data, we could, and also get more supply and availability of vaccines, we could revise that downwards. But for now in Nigeria, it stops at 18.
18 and above. Okay, fantastic. I'm going to bounce back to you, Gochi, because I have a question for Habi again, but I just want to put you before that. We've heard about the side effects of the vaccines, of the vaccine rather. Is there any information on side effects as regards sickle cell disease individuals?
So I don't know that we have specifically, but I can tell you from my experience with my patients. So the general side effects you could get from this vaccine or any vaccine, you could have some pain, you could have some swelling, some redness at the site of the vaccine. You could have fevers with the COVID vaccine, or nausea, headaches, things like that. You could also have like a very severe allergic reaction, but this is rare, which we call an anaphylactic reaction. But this only happens rarely. With my patients, I've seen people who have had pain at the site of the injection, who felt a little more fatigue. A few of them, a minority of them, will tell you that they had some pain, or it kind of tipped them into a pain crisis after the vaccine, but this is a minority of them. Now, on the pediatric side, the people who have gotten the vaccine, the 12 and above, they've done largely well. We know the kids are more resilient, so they've shown less side effects. But the adults, these are the common side effects: and pain, swelling, a little bit of fatigue, and a few people kind of gave them some pain or kind of tipped them into a little crisis.
Okay, thank you very much for that. Okay, so before I go back to Hadley, one more question for you. So of course we know a lot of warriors are listening in on this. A lot of caregivers to warriors are listening in on this too. Some of them have taken the vaccine, some haven't. Some are still contemplating. How soon after a recent sickle cell crisis can a warrior receive COVID vaccination?
So as with any interventions, we want you to be at baseline before you get the vaccine. So if you're having a crisis, I want you to have fully recovered from the crisis before getting the vaccine, just to be on the safer side.
Fantastic. Thank you. Oyesola, I see you nodding your head. It's like you've been informed about that too in the UK. You want to say something? Oyesola, sorry.
No, that's fine. I was agree with Dr. Ugochi, because the truth is that apart from even just common sense would say that if you're having this, you may have this is it what they call it, reactions after the vaccine, maybe fatigue, maybe pain. You would want to be that you are in stable state, before you go for it. So I was nodding my head because I remember, someone was saying just, I think yesterday or something on the group, that she went into a crisis. So I was thinking to myself that, things like, apart from even being in stable state, you want to make sure that you're well rested before going. You want to make sure that you are well rested when you're done. You want to make sure that you are really, really hydrated, Don't even give it any chance to really, really hook you down. So apart from being in stable state, you also, the warrior, you want to try your best, So what happened was, when I took my vaccine, I did post it on social media, my page, Sickle Cell Convos, and then my local county, NHS North, reached out to me that they realized that a lot of people from BME communities with that were chronically extremely vulnerable had not been coming out for the vaccine. So they did a short interview with me where I spoke and said, you know what, it's safe, you guys should come out and everything. And I tell people that the only thing I would even advise is just take some paracetamol 30 minutes before, and you go home and you rest. Some people say, I don't take anything, and I get back home, I don't take anything. Even when you take the flu vaccine, I'm sorry, I'm just saying this, I told people when I took the flu vaccine, it affected me more, it weighed me down more than the COVID vaccine. So you never can really say the way you react to these things. That's just the truth.
Thank you very much.
I want to piggyback on what Oyesola said, and we should remember that the sickle cell pain, it looks for any reason to rear its head. It's too hot, it's a crisis. It's too cold, it's a crisis. You're stressed out, it's a crisis. So I'm not surprised that a few people, you got a vaccine, let's get a crisis. So I'm not surprised. So like she said, make sure you're at your best, your optimal state before you get it.
Fantastic. Hadley, do we have, because you did mention something about data, I just want to find out if we have any documented pharmacovigilance reports for sickle cell disease patients' response or reaction to the COVID-19 vaccine?
Yes, so that's a good question. And so currently we do have AFI surveillance, safety surveillance, pharmacovigilance for COVID-19 vaccine set up, for the adverse events following immunization, as well as adverse events of special interest, not separately or particularly for sickle cell, but just generally. But there are some options and areas where we can get some of this data, and that's with the NAFDAC. NAFDAC has rolled out a med safety app. This app is for everyone who has taken the vaccine to download on their Android devices and continue to report on any adverse events they have. And so this med safety app for anyone who has received the vaccine can go in, download on your device. And if you have any adverse reaction, some of the questions include any of these underlying diseases, as well as the data collection platform I talked about earlier. It's called the EMI. We have a module on it that, kind of gets information on the adverse events, following immunization or AEFIs. And there we also have underlying diseases where people are asked if they have hypertension, diabetes, sickle cell, and a whole lot of other underlying ailments that need to be followed up. So we don't have particularly for, or delineated one for sickle cell, but we do have the general one. And we're trying to collect that data, analyze, as well as do some causality assessments, because this is very important. The fact that someone has a reaction, say, a febrile illness or fever after taking a vaccine, does not mean that it's the vaccine that particularly caused it. And so we have to do all of those assessments, which is ongoing as we speak, so that we're sure that we can link that to the vaccine they have received.
Okay, and all of this data can be accessed by us if we want to?
And if this is routed through the right channel, the Primary Healthcare Development Agency, the NAFDAC, of course, they will provide this if you need that. And, there are points of contact. We can facilitate conversations and have you get the data anytime you.
Okay. All right, Jake. So let's talk about something a little bit more general now. When it comes to receiving the vaccine, there's a lot of fear in people, both sickle cell warriors and non-sickle cell warriors. What do you think can be done about this? You're big on awareness. You've been with Scaf since inception, and you've done a lot of awareness programs, Scaf and outside Scaf. So what steps can we take? What steps can we take, us in Scaf and people listening, to just douse this tension and this fear as regards the vaccine?
Very important question, and thanks for that. Vaccine hesitancy is a very real issue. And you can imagine people who have families or people who are living with sickle cell, they don't know. They don't have any information regarding, do I take the vaccine? Is it going to compound my situation? Yes or no? And so one very simple tip could be this recording, take it to NTA, because this is pretty much a privileged platform. Not everyone has access to the internet or to be a part of this conversation. It's not new to always have Scaf be the only one who's pushing the frontiers on conversations that are as relevant as this. But information dissemination is very critical. People need to know if they can take the vaccine, when they can take the vaccine. Like, I'm hearing some information here which is critical, like, okay, maybe after your crisis is over, what age can take the vaccine? How is it possible that people who are living with sickle cell, who still need life-saving care, can access them despite the focus heavily premised on COVID-19? So knowledge mobilization is really important. We need to sensitize as many people. But even from this conversation, I'm hearing two things. Maybe from my legal perspective, I'm thinking liability. If a young person living with sickle cell is less than 18 and they can't access a vaccine and they contract COVID and it gets more complicated for them, what is the solution, right? Even when it comes to collecting data, I'm hearing that data is being collected, but it's not particularized, right? We don't have specific data on persons who are living with sickle cell. How many people living with sickle cell are taking the vaccine? What were the reactions that they got from the vaccine? How different was it from other individuals? Someone is asking on the chat, like, oh, is it possible that people who have sickle cell could be immune from, contracting COVID? There is information out there, right? I've heard things about oxygenation and the blood and how that relates, but we don't know. So if we here as experts, we're saying there's data, there's data available, but it's not particular to sickle cell. You can vaccinate or you can get your vaccine if you're 12 years and above, but for sickle cell, there's no exception to that. We're still mobbled in a generalistic policy, which doesn't really help as much as possible. So aside popularizing and spreading information and sensitizing, we must put people like, Hadley and Destiny, who work in this space, and say, we need you in those rooms, in those sectors, to specialize data collection for people who are living with sickle cell, to specialize particularizing people who are living with sickle cell to access the relevant information, to access the healthcare that they need at such critical time, and of course, to prioritize their vaccine collection as well.
Well, thank you. Thank you. Information dissemination. Okay, good. Because we're running out of time, I'm just going to round up the specific questions to the panelists now so that we can jump into the questions from the attendees. I'd like to come to you, Destiny. So Destiny, during the lockdown, access to health facilities were impeded. You had mentioned some strategies that were put in place. How can future strategies accommodate these issues? Because you had also said that this is a learning curve. We've learned quite a number of things from this experience. what are the other measures or other strategies that you think we can put in place for the future, having learned some things from this?
So I think the major thing for us, and I think Hadley would also agree from our experience working very closely with our countries, with the government, is ensuring that we have solid documentation of all these previous experiences. This is not the first time that we're having a disease outbreak, although not at this magnitude in the country. If we just recall to a few years ago, there was also Ebola that was in this country. What were the experiences during the Ebola crisis that we could have taken forward with COVID-19? So in the same way, even as we're living in a post-COVID world, is documenting those experiences from the lowest level, starting from the communities to the state level to even national, to be able to ensure that whatever we do develop future strategies for prevention. I think we all know public health is all about prevention. Prevention is always better than the cure. So if we do have mechanisms in place, not just the policies, but we even have the infrastructure, if we make sure that we do leverage coordination groups at irrespective levels, whether it's state or national, to be able to be on in standby mode, right? If we start to see situations like this roll out, we'll be ready, right? So I think that's really important, making sure we have the policy, making sure we have the processes, and then in terms of people, build the capacity of the people so that they will be ready for a situation like this if it comes up in the future as well. So I think if we're able to build policy processes and practices, we'll definitely see a more resilient primary healthcare system to be able to address some of these issues that we see around outbreaks.
Great, good policy and capacity building. Thank you very much for that. All right, so I have one or two questions, but let me just go down to the chat room. I think there's some questions here. So one question from Elma Aluge. This is directed to Gochi because it's an offshoot from your answer. She says the sickle cell disease cases on the US database, what percentage are children, and can the numbers establish a need to reduce the age for vaccination? I think that might have been answered in one way or the other.
I answered him in the chat, and I said that children are in the minority. If you're talking about people who have gotten the vaccine, children are in the minority, and that's because the approval for people who are 12 and above just happened recently. If you're talking about people who have had the COVID infection, there are lots of children who have had the COVID infection. And if you go to that website that I put, the website that has the data, there's a beautiful breakdown based on like the age. They break it down based on like different age groups. But it's mostly the most severe cases happen in people who are adults. So in that registry that had 784 patients, there were 377 that were less than 19. However, only one, that was almost a little bit less than half, but only one death occurred in that population. The rest of the people who died, the 18 other people who died, were in the adult population. So there's a good representation of children when you have people who have had the COVID infection, and I say they're more resilient. But when you talk about the vaccine, it's now that we'll start to get those numbers because that approval just happened recently.
Thank you very much. So I just went through the questions there. I think most of the questions have been answered already. So I'll just go to two specific questions that have come in earlier. And the first is concerning the variant. We've been hearing about the current variant for COVID. So how dangerous is the current variant of COVID for those who have already completed their vaccines? Gochi, can you? And then
so there are different variants or strains of a virus. Some of them are more virulent, some of them are more deadly than the others. There are different ones that have come out. For some of those that have come out, they've checked and they've seen that most of the current vaccines can cover it, but then there's always a new variant every once in a while. And so without testing, we won't know what fully covers what. But we know that some of the variants that have been found, they've shown that the current vaccines are efficacious against them.
Okay. Something more specific to sickle cell disease, this was asked by someone else too, says, is sickle cell a disease?
Short answer, yes, it's a disease.
So I just like to
it's
tell
a
you, if
disease.
you see the definition of a disease, you know that sickle cell is a disease. I think it just comes down to a mindset. You know, when you say disease, you know, people are thinking, oh, it's the worst case scenario. You know, someone's carrying leprosy, or even leprosy too. Now you know have measures that have been put in place, you know, to prevent for further complications. All right, so that answered that question. It is a disease. All right.
Yes, we have a question in the Q&A that somebody asked, Omar, and he was asking if there's any research specific to the genetic makeup of a sickle cell warrior depicting the tolerance of the vaccine to our genetic makeup and the efficacy. And I asked he or she to expand, and the person said, I meant specific research that exactly states how the sickle cell patients react to the vaccine. I don't know that we have specific research apart from just anecdotal experiences like I explained with my patients. There may be a group that's putting that data together. So I don't know that we have specific, you know, like a research study that's looking at that, but there may be something in the works.
Okay.
And somebody else is asking, how do you differentiate sickle cell disease from sickle cell disorder? So sickle cell disease, sickle cell disorder, when people say that, they're mostly referring to the same thing. So it's still sickle cell disease.
Nomenclature. Okay. All right. So Jake, what is the main message you would like the audience to take away today?
For me, I think the main message would be that we need to use what has happened with COVID-19 and move towards a more robust legal structure that actually protects and prioritizes people living with sickle cell. This is not the last pandemic we would face in our lifetime. And even before the pandemic, there has not been equitable health structures and systems that cater to people who are living with sickle cell in Nigeria. So we need to take all of these non-answers and all of these gaps and move forward and see how can we create a more sustainable structure in terms of policies within our hospitals, in terms of, you know, our workspaces, and of course at the level of the National Assembly too. We need to ensure that laws are actually adequately passed, because I know that healthcare is covered under the fundamental objectives and directive principles of state policy in the Constitution. I mean, healthcare is a fundamental right, but we don't see it enforced per se. But just like the Universal Basic Education Act, if we have the Sickle Cell Management Act, a better version actually being passed, we can actually take that as a tool for advocacy to ensure that people who have sickle cell, they can see themselves on these policies, they are prioritized, and healthcare is given. The last thing I would say is, I know we heavily focus on, you know, the medical side of things, you know, vaccine, no vaccine, but let's not forget the much more home care need that we need to check up on people who are living with sickle cell to ensure that they have the support system that is there to provide, you know, if it's care, if it's food, just like Oyesola mentioned, you know, I think it's also much more critical at this time. The anxiety is high. The plenty questions, no answer is also high. So we need to ensure that we can reach out to our, you know, our loved ones in this regard. Thank you very much for having me. I'm so grateful to be a part of this conversation.
Thank you, Jake. It's a pleasure having you. Takeaway message, Oyesola.
I have a lot. First, I would say to people like Adley and people like Adley and Destiny that are, you know, close to the corridor of power and within the data space. There needs to be a lot. There's still a lot to be done, to be honest. Even in the UK, it was like COVID brought sickle cell to the front. It wasn't every day you heard them talk about sickle cell on TV. You know, now we're already talking about booster doses in the UK. But most of the warriors in Nigeria haven't even gotten their first dose, not to talk of the second dose, not to talk of the booster dose. So there is still so much to be done. It was so painful to see that during the pandemic, it was just the NGOs delivering food packages like Scaf did, a few giving them money. The government did totally nothing. We still have a lot to do. And I'll just say, if you're a warrior, you have the opportunity to get the vaccine. I think you should get it. You have more of an advantage. getting it, than not getting it. There's really nothing to worry about. I know people used to joke that get your own first. Let's see, maybe you start switching, and those memes that were going around then. There's really nothing. If you can't get it, get it. Some people are worried though because they're giving AstraZeneca in Nigeria. Again, I was telling somebody some days ago, more women on contraceptives have gotten the blood clots from contraceptives than people that have gotten from the vaccine. So what exactly is, you should go get it if you have the opportunity to get it. Thank you.
Thank you very much. So before I move on to Destiny, this is for the attendees, so you don't start logging up. There's always refreshment at the end of things like this. So trust Scaf now. Scaf is going to refresh you guys. Well, unfortunately, we don't have enough to go around, so we're just going to pick one lucky person. There's going to be a brief quiz from everything that has been said today, and there are going to be 3 questions, 1, 2, and 3. 2 has A and B. The first person to correctly answer all questions right would win 10,000 Naira. Okay, so let's move on to the main message from Destiny. Thank you so much, Onishola.
Thank you very much. Just riding on what others have said, I think the major thing that comes out for me is that we need to commit ourselves to a multidisciplinary approach. COVID-19 is something that's unprecedented, the use of vaccines, but even as we've spoken, there's still so much inequity within the healthcare system. So we have to ensure that we're working together collectively. So like you mentioned, you have the likes people like Jake who are working in the legal space, people who are warriors themselves speaking out. So how exactly are we engaging? How well are we collaborating with the likes of Scaf and other similar organizations that do provide voices for our warriors? So I think that's the major thing, is just continuing to open our minds. And I think, as mentioned, myself and Hadley, we would do due diligence in ensuring that we do support the government to ensure that we have more inclusive conversations and engagement with those key stakeholders accordingly. Thank you very much.
Fantastic. Thank you so much, Destiny. Okay, so Hadley would like to see your face. Since we didn't see your face all through, can we see your face as you give us your main message?
Yeah, that's very fine. Thanks. So I'm going to show you my face in a short while. So maybe you can just leave me in the dark for now. Maybe during the next session. Yes. But actually, just to, and on a serious note, I think COVID-19 and the disruption it has created has also made all of us, become one globally. And everyone is on the table right now talking about the same things and the same issues. It's also brought into light a lot of things, the inequities, the very weak health systems, the weak support systems, beyond health. And I think it's an opportunity, an awakening for everyone, to work together. It's not it's beyond just one person, one organization, as well as one government. It's a world. For example, we see vaccine donations and sharing between the US and other countries that have had more than enough doses of vaccines, sharing with other countries. We see facilities like the COVAX through Gavi, trying to get funding to procure vaccines and then distribute free to countries that can't, afford them or can't even get them, even if they had the money. And I think it's a call to humanity. We need to go beyond. And I know that we're talking about sickle cell disease right now, but what's important is the fact that there's a whole life course approach, looking at young ones, children yet unborn, women of childbearing age, adults. We're looking at our geriatric age, the older people who are really, falling more to these, and how we protect ourselves and the whole of humanity towards global health security. And I think this is one thing that has shown that beyond health, the social determinants of health are very important. And I think we continue pushing this message as we continue the different aspects of our work, from Jake, to Dr. Ugochi, to Destiny and I, and to everyone, so that we work together, to ensure that people have access when they need them in an equitable manner, just to ensure that, humanity moves together towards a better direction. Like someone said, this is not going to be the last pandemic. We've seen some in the past. This just had the world's attention at one time. So we know that a lot more of these kinds of things are going to come out. So
hello? Did we lose him there?
I think it's a call to action, but for one action generally, as we go. And yeah, Jake, I'm here. So I just wanted to thank everyone, for having me to be part of this discussion today. I know this isn't going to be the last time. We're always available, to provide answers, support, and we can always continue this conversation, offline. Thank you so much. Over.
Fantastic. Thank you so much for being here. So last but not the least, Dr. Ogochi.
Hi, yes. So as somebody who takes care of both pediatric and adult patients with sickle cell disease, I call myself a lifespan sickle cell doctor. So as a lifespan sickle cell doctor, as a sickle cell expert, I highly recommend the COVID-19 vaccine for people living with sickle cell. And I want to really give props to the people who put this webinar together, who put this panel together. These are the kind of things we want to see in the sickle cell world, people working together. So we have the experts in the medical field, we have the sickle cell patients themselves, the warriors, we have the NGOs or community-based organizations like Scaf, we have people like Jake handling the legal and legislative part, we have Jake and Destiny from public health who are going to help us take care of the healthcare disparities and implementation of whatever policies we have. So we need like this work to continue together. And any avenue to educate about the sickle cell disease is a plus, because with sickle cell, education is key. I keep saying education is key. And like I said in my most recent publication on a review of sickle cell disease, the taste of the pudding will be in if we can take what we have in the developed world and implement it in the lower or middle income countries where we have the bulk of the people with sickle cell disease. So it's not enough just that the people in the UK and the US are doing well, and then the sickle cell warriors in Nigeria are doing so much worse. So that is not okay. So we have to, the race to the cure, the race to elimination of sickle cell has to be on a global level. That's all I have. Thank you for having me.
Fantastic. Thank you so much. Oh my God, I'm so proud to have you guys on my contact list. Like my sugar powder boy. Thank you so much for being here. So I'm just going to round this up by throwing out the questions for the quiz. So let's see who our lucky winner will be. Okay, so first question. People living with underlying conditions such as sickle cell disease are categorized or in what category? First, second, third, or fourth? Please put your answers together. So just wait. This is number one. Wait, the other ones are wait, calm down. Elma, calm down. Your answers have to come together. Question number 2A. What's the youngest age that can receive the Pfizer vaccine? That's 2A. Youngest age that can receive the Pfizer vaccine. You guys that are dropping your answers now, you are wrong. You put everything together. If not, your sheet will not be marked. And 2B, youngest age that can receive the AstraZeneca vaccine. 2B, youngest age that can receive the AstraZeneca vaccine. Third, but not the last, third and last question. Third and last question. What agency developed a safety app to track response to the COVID-19 vaccine? Those are your questions, 1, 2, 3. Third again, what agency developed the safety app to oh my God, some people are sharp. Okay, all right, thank you so much. I'm just going to go through and see which one landed first in my chat room. Adedamola, sorry, your B is wrong. Your 2B is wrong. Elma, sorry, your 2B is also wrong. Emma, looks like you copied Adedamola. So I still do not have any correct answer. Nuruddin, your first answer is wrong. And your last answer is also wrong. Oh my God, so nobody's going to win this 10K. Wow. I think that will said wait. No, once you've given the wrong answer, you can't give another answer. Let's see. Let's give chance to. So Shakira Bashir. Shakira Bashir, your last answer is also wrong. Oh my God, no, you guys. Med share. Wow. Okay, so I don't think anybody's gonna get this. Okay, I think we have a winner. Ejura, the first correct set of answers. Ejura Opalua, category 3, that's correct. 2A, 12 years, 2B, 18 years, and number 3, NAFDAC. Thank you so much. Ejura Opalua, please let me take that name down. Ejura Opalua. All right, that's our winner for today. You get 10,000 naira. You get 10,000. Everybody gets 10,000 in spirit. Only Ejura gets hers in physical. Thank you so much, guys. Thank you so much for being here. So I'll talk to you some other time. Have a wonderful evening.
Thank you for having me.
Thank you. Wherever you are. Bye-bye, guys.
Thanks, everybody. Be safe.
Bye. Thank you, guys. Bye.